My name is Gary Yabuda, and I am the Executive Director of the Hawaii High Intensity Drug Trafficking Area, HIDTA. I am so honored for the opportunity to be here with you today, supporting the annual HIDTA prevention. Here in Hawaii, we have worked hard to support prevention in meaningful ways. Drug prevention methodology is a dynamic process, and our efforts to reduce drug abuse is a never-ending science for all of us. Hawaii is blended with a rich traditional culture that is deeply rooted from the spirit of our sacred island landmasses and ocean. Unfortunately, our native Hawaiians and ethnic minorities suffer the most from drug abuse, in particular crystal methamphetamine and now fentanyl. Our concept is to institute youth wellness programs that uniquely fit each of our multi-ethnic communities, many of which English is a second language. Meeting the diverse needs of our Hawaii communities here at Hawaii HIDTA is what our next presenter accomplished throughout the world. So it gives me great pleasure to present our next presenter, Dr. Wadi Malouf, who will share with us a global perspective on prevention in youth. With 25 years of working experience in assessment of drug use situations, orientation of national drug control strategies, and technical assistance in health responses to drugs, Dr. Malouf currently coordinates the drug prevention program globally at the Prevention, Treatment, and Rehabilitation section of the United Nations Office on Drugs and Crime, a role he has filled since 2011. Between 2005 and 2010, Dr. Malouf was a UNODC Drug Demand Reduction Advisor in the Regional Office for Middle East and North Africa. Prior to joining UNODC, he worked with the Institute for Global Tobacco Control at the Johns Hopkins School of Public Health and was engaged in drug demand and mental health research amongst university students in his home country, Lebanon. Dr. Malouf holds a PhD in epidemiology with a focus on drug and mental health epidemiology from the Johns Hopkins School of Public Health. He is a contributor to the INSPIRE Interagency Initiative to End Violence Against Children and the UNODC World Health Organization's International Standards on Drug Use Prevention, and has several publications in the field of drug demand reduction. On behalf of the Hawaii HIDTA and all of us here today, we convey our deepest aloha to Dr. Malouf for his contributions to the field and for being here with us to share that work. Dr. Malouf, mahalo, which means thank you in Hawaiian, and welcome.
Thank you very much for the lovely introduction. Aloha back for you, and aloha. And my special thanks for the organizers for inviting UNODC in general, inviting me to be part of this podium to share some of the experiences we have that hopefully will shed further light to the great panelists that were presenting on the issue of prevention. I was given the challenging task to address the issues of today in the context of substance use prevention in youth. At the outset, when I was preparing this presentation, there are so many issues to address. I did my best to categorize these issues in the priority that I can address in the time allowed to me in this presentation. And I really hope that these priority issues, that there are more of them, cover also a lot of the infrastructure that is needed for the additional issues that I have in mind. And with that being said, I move to one of the first issues that in our work as the Office on Drugs and Crime, which is we're a technical desk that support member states on several areas of drugs and crime. And within the drugs, of course, the health response to drug is one of the key areas that we have. And within the health response to drugs, we have a spectrum of responses. I happen to coordinate the prevention part of this. And in our work with our member state, these are some of the main issues we face when prevention is at stake and prevention of, especially within youth, is being considered. The first issue is the concept of the science of prevention. The science of prevention is very important to reflect the fact that we're, as I said, we're an office of the UN Secretariat. I mean, our member states are the parliament that kind of direct what sort of responses are needed in context of the larger drug situation that's happening globally. One reassuring fact we have, and they draw political declarations, they blow globally, as well as resolutions in terms of mode of action. One of the important political declaration that has a span of 10 years, from 2019 to 2029, and actually next year, 2024, will be its midterm review, is our Commission on Narcotic Drugs, which is the parliament that oversees the drug response globally as member state, have called for strengthening of action, national, regional, international, at international level, to accelerate implementation of the joint commitment to address the drug problem. This has been in the Commission on Narcotic Drugs, which is the member state that exists at our level in Vienna, but also at terms of the General Assembly of New York, where also that commitment, that joint commitment, is also reflected there. The assuring part is the fact that that commitment in its preamble includes the fact that collection of data, working on drug use epidemiology, and addressing prevention and recognizing new tools of prevention, including the International Standard of Drug Use Prevention, is there. So that balanced approach in terms of health, response, demand reduction, and supply reduction existed. Prevention has always been there, but prevention that is based on science is getting more and more articulated in these policy documents. So that culture of not only talking about prevention, but talking about prevention that is based on science, at least at the level of political commitment, is there. So this is where, as UNODC, to further support the prevention of that is really being taken at the political level within the member state, we had to support these member states really change the framework of thinking in terms of the science of prevention. Yes, the prevention center have now been articulated, which is a breakthrough, but now we have to work with them in terms of changing the mentality of policymakers, their framework of thinking when prevention is being applied. So the concept that prevention is a science is a core component of our tool, which is UNODC WHO International Standard on Drug Use Prevention. When we say that we applied the WHO standards of prevention, it reflects already a level of science that exists, and reassuring the policymakers that if you want to work on prevention, there is no need to improvise. There is a science that is there. More importantly, that science reflects the fact that prevention of drug use goes beyond the general awareness raising or the fear arousal messaging that exists in most cases when it comes to addressing prevention as an intervention. Also, that same prevention standards engages with policymakers to really change their horizon and think about the fact that in most cases, early initiation at younger age is not the result of a free choice, where messages of just saying no would be enough. The situation is deeper. And as I move more along in terms of the slides, it will be recognized more how we're kind of changing that perception. Another important part of that science of prevention that we're advocating with policymakers is engaging with the policymakers in a situation that really help them shift their focus from drug being the issue and discussing, that is my drug of concern, and focusing on the developing individual and how can I help this developing individual to overcome their vulnerabilities in different ages changing as such the arsenal of responses that can be implemented within that framework. That's a radical shift of thinking of responses. And another thing that the prevention standard try to help policymakers with is the fact that recognizing that the majority of the interventions that are part of the prevention standards that I'm talking about really help personal growth, the intellectual, the language, the cognitive, the emotional, the social competencies and skills that are needed in different ages of development, rather than just information. I mean, the information might be important at a certain level and a certain age, but there is a much larger spectrum of responses that can and is evidence-based per the standards that can be applied to help these individuals. Also, the fact that in that mentality, not investing in prevention is also comes at a cost. So, and I guess probably as we're coming out from a major pandemic, it's more and more evidence, even though we're talking about here an uncommunicable disease, an uncommunicable situation, but not investing in prevention is not a cost-saving measure, and it's not a liability that, depending on the budget of certain governments or certain community sectors, that can be sacrificed based on different circumstances. Not investing in prevention has a cost, and that cost in most instances is much more impeding and much more imposing on the government than the cost of the prevention intervention per se. And most importantly is the fact that despite all good intention, not the worst outcome that can come from non-evidence-based prevention intervention is not an ineffective intervention that can be changed at a later stage, but rather there are several interventions where we have iatrogenic effect, meaning that the intervention per se out of all good intention has caused more harm than good. And this brings up the ethical perspective of investing in this level of prevention to a different dimension of implementation. So that science is important for the policymakers to understand moving forward. An additional part of the science as an issue where policymakers were unpacking these messages too, is for them to realize the fact that it's not only in the age when substance use initiation occurs that we can intervene. That change of perception, when we're talking from a developmental perspective, reflect the fact that we have evidence, again, by WHO standards of evidence, of intervention that can be effective as early as when the child is in the embryonic stages of the pregnant mother onward. And then the policymakers start to realize two things: not only that I can intervene only, but there are so many other interventions that exist in terms of services at the community level or at the country level that have never been accounted as part of the drug prevention strategy, just because the intervention per se did not mention the word drugs. So that developmental approach also capitalizes on a larger infrastructure that has never been really considered as part of the prevention response. And that is part of the science that exists. Another part of the science is the fact that there are not leaving anyone behind in the sense of there are interventions that are universal that you can see in green, interventions that are selective, that are for a subpopulation that are at higher risk than the rest of the population. And there are interventions that are indicated for population that are having symptomatic symptoms of a problem that need to be addressed before it escalates into something bigger. So that change of perception is important, and also reflects the fact that from a developmental perspective, no one agency can deal with the response of a child being raised. It takes a village to raise a child. So there are several social institutions that are influential in the developmental pathway of a child. And then it is working together with a common vision that this can work together. And that's an important issue and a change of perception that we're working with policymakers. One of the key components in terms of agents of prevention that we're working with, and that's a new tool that we have introduced, is how to orient that science in the context of law enforcement and their implementation of that science of prevention, really inducing the science of prevention within the law enforcement agencies when they are approaching that responsibility. In the United States, maybe that's one of the agents of many agents of prevention that also can benefit from this program to bring them closer to the larger response of prevention. However, from a developmental perspective, however, in many countries where we are engaged, they represent sometimes the sole provider of prevention responses, and that's why arming them with the right tools is key. So this guiding document that was introduced recently is one of the tools where we are trying to induce that science of prevention in different modalities, in different sectors of the prevention response. So that's the first issue, that science of prevention, that culture of science of prevention, inducing it in the different agents of prevention is a key component. The second issue is the link between that modality and that way of thinking of prevention with sustainable development. So we are living in an era, aside the fact that there's a political commitment in terms of addressing the drug problem in line with science, but when we are also having another political larger commitment, which is the path to 2030 in terms of reaching the Sustainable Development Goal, the Sustainable Development Goal agenda. Yes, there is a specific goal on health, SDG 3. And yes, within that target now, there is an important target within that goal, SDG 3.5, that mentioned that strengthening prevention and treatment responses is part of sustainable development. And that's a key shift of thinking for policymakers. It's not addressing prevention of drug use from the perspective of human rights and only, and availing the right tools to the right people, but also that mentality supports the general development of the country. And that's a core component to add to that culture of prevention messages that we are promoting as part of the prevention standards. How is it so? Because that same mentality that we're talking about in terms of framework of thinking reflects the fact that the vulnerability that we're addressing and we're talking about when it comes to substance use initiation is one that is anchored to a biopsychosocial model of problem, meaning that every individual have their personal characteristics, their genetic makeup, their mental health rate, their reactivity to stress, their neurological development, who they are as a person under their skin. That person lives within, is influenced by microstructures around them that are important for development. The family, the school, the peers, and how they work and function is important and interact with who the person is in terms of characteristics. But even these social institutions are part of a larger environment. And you can imagine a family or a school in a context of social inequalities or conflict or displacement or high level of violence or accessibility to drugs or weapons is different than a family that or a school that is a different context. So the macro environment affect the microstructure that we're talking about. And needless to say, the macro environment has a direct effect also on the personal characteristics. And that vulnerability matrix for policymakers to appreciate is a key component for thinking and addressing the problem. So basically, when you talk about a certain child that has neurological development issue, or maybe high reactivity to stress, let's say, inattentiveness, living in a family structure where there's poor engagement and involvement in a school context that is not doesn't have a structure that is appreciative of quality early education, living in a context where there is social inequalities, that child or the thousand of other children like him or her in that surrounding needs more than a message of just saying no to drugs, needs more than information about drugs, needs to assist that person individually and the structures around them to support that child moving forward to prevent drug use. But what is more important is that same vulnerability matrix is not only unique for substance use initiation. And that's a return of investment that policymakers start to appreciate in the context of development. That same vulnerability is linked for outcomes that are beyond substance use, from mental health to academic failure to violence and to poor physical and mental health and beyond. And that is a key message that we're trying to move forward as an issue. That developmental perspective. Each stage of development is associated with certain milestones that need to be attained intellectually, language, cognitive ability, and beyond. And each one needs special attention to prevent onset of substance use at a later stage. In that context, it's important to remember that boys and girls have different developmental pathways. Boys and girls are affected by the environment in different ways. So a gender-sensitive response as well, and not necessarily a one-size-fits-all model, is important. Yes, vulnerability. But vulnerability is not only risk. We have to increase the protective factors, attenuate the risk factors. And it is that combination of intensifying that green line and reducing the effect of the red one that is key. So it's not only addressing risk factors, but strengthening also resilience factor and protective factors. That modality is important because it also supports the investment of in prevention that we really are keen on, particularly as we move hopefully away from the pandemic, where there has been a momentum generated, and the pandemic has focused lots of attention on quick economic recovery measures, and we need to reinitiate that momentum of member states to really focus on prevention being an important investment in terms of development, an investment that is common to many strategies beyond the strategies of drug use prevention, strategies of ending violence against children, which is increasing post-pandemic, mental health of adolescents, and which is also increasing post-pandemic. So this is a period where like these actions and that mentality that we're promoting pre-COVID-19 is more important than ever, and including youth engagement in violence. So the return of investment in that modality of thinking helps multiple strategies, and that is one of the issues that we're working on. The issue of, yes, it is a target which is important for development, but that same target that we're working on, if you're working it from a scientific perspective, helps you on more than one sustainable development goal, at least in terms of quality education, SDG 4, SDG 16, on the violence indicator, on gender equality, and beyond. And so the third issue is an issue of the culture of research. So that science that we're promoting top-down needs to be also coupled by a bottom-up approach, so top-down, we're working with policymakers, change their mentality of, what prevention is, so that service providers will get the chance to have these tools that are evidence-based. But also these service providers need to demonstrate that these evidence-based tools is not science only, it's not science fiction, but it's scientific reality that can really make a difference on the ground in the countries where we're working. So that culture of research is key. Demonstrate the transferability of the evidence and of the intervention. We're advocating as much as we can in terms of really not only having an intervention, but also, that looks like in line with the standards, but advocate for evaluation and monitoring the research, especially in low-middle income country, what that culture of research is for. But also research on scalability and sustainability, as well as cost-effectiveness, are key. And we're providing the political framework to reflect on why this culture of research is important, and why sometimes that fear of research should be avoided. Because research is not the culture of research is not one that's a pass or fail grade, but it's a culture of improving on what you have, so that you fine-tune it in order to improve on your effect or make it more effective. And that is a culture that also we're working on as an issue moving forward. We are, as UNODC, working with many, because of our field presence in many countries around the world, working on documenting that mentality, that culture that we're talking about in terms of an implementation and a policymaking structure does have an effect in the diversity of countries that we're working to also support that culture of research ourselves. While we're approaching, for example, family skills in the context of drug prevention in Latin America or in Central Asia or beyond, we reflect that same program that we have is having an effect on more than what we intended to put it. May it be on violence, may it be on the school climate, may it be on promoting safe development of a child within the family in general. So by the way, all of these articles that you will see on the slides are publicly accessible and you can feel free to download them. That's on the level of family skill, but also on life and social skills, because we know that these two social institutions, maybe the school and the family, are probably the two most influential social institutions that can be in the life of a developing child. And when they both work together, they have a multiplicative effect of prevention. That change of culture, we're demonstrating it as well. The fact that you're introducing a program and having it an effect somewhere else. We can pick another example from Panama, for example, where Strong Families program, for example, when it's piloted there, Familias Fuertes as reported there, changed the mentality of the government considering how to address youth-based prevention, youth-based, violence at Panama. That culture of prevention at the general policymaking level as well, we have documented, and it's a key component of our work moving forward. That is one of the publications we have put in Prevention Science. So where are we going with this? What we're going with this is like trying to move that culture of research to a perspective where UNODC, as we speak, is trying to have a new initiative in the development that will be announced soon, which is the CHAMPS initiative. The CHAMPS initiative is an initiative where we are trying to demonstrate scientifically, not only like a pilot of a program and its effect and intervention on substance use, but we want to see the amplified effect of a system of services coming together on scale in demonstrative countries where we're engaged with, to showcase that level of investment really can make a difference in the developmental pathway of children as they grow. And an investment that goes at very early stages of development, as early as their birth onward, following them up to showcase that investment works, because we get a lot of questions. Where did prevention work? Yes, this intervention worked here, that intervention worked there. But what kind of system really reflects an important sort of investment that make a dent in the life of development of children is something we're working on. So stay tuned, and this is an issue that we are working on as we speak. So stemming from this issue is the issue of systems of prevention and the focus on early prevention as an issue. We talked about individual intervention and the standards, but we know that interventions, evidence-based packages are important, but these evidence-based packages are integrated in a system, in the receptacle, in a machinery that implements these programs. And it's not only the evidence-based program that's important, but the functioning of that system is a key component to have an effective prevention. And that functioning of a system of prevention is an issue that we're trying to address and support. In our prevention standards that I referred to before, if you look at the base, there's a specific chapter on the systems of prevention that we're trying to expand on as we speak. So the implementation of strategies based on scientific evidence, data, and evaluation, which is at the base of the slides that you see here, is a de facto and clearly a core element of the response. But that's not enough. These responses require a range of stakeholders involved in the planning that are having a common vision of what that prevention response should look like, and how to address the problem, and how to identify the gap to fill in these implementation strategies. But these range of stakeholders in planning are also need to have a strong delivery infrastructure. The legislations, the legal framework to operate in schools or at the community level and beyond, the human resources, the financial support to implement these activities, and the longevity of this financial support. But that infrastructure also required stakeholders at the delivery level, at the local level, not only at the larger governmental level. And that cycle is important to kind of be well-oiled machinery in order to have a system that is a health-centered approach to respond to drugs. So this is also why we're working on that demonstrative program, which is Shams had worked on. But specifically, we have a new tool that we're introducing to these member states, which is a review of the prevention system. In our experience, most strategies are both on an epidemiological assessment of the situation that is being dealt with, a review of changing trends, the main problems that exist, the risk and protective factor that exists at the community level. But when it comes to assessing the infrastructure that exists to deal with the response, most of the SWOT analysis, the strengths, weaknesses, opportunities, and threat that exists are based on qualitative discussions between different entities that are having these services. But there is no real structured quantitative arbitration or an evaluation with a clear reference on the services that exist or don't exist. And that is the value of the RAPS model that we're discussing, where services, first of all, when you expand your horizon to think about the different services, you start having a wider scope of what you have, but then you start comparing these services that exist at different ages of development within different social structures that works with the children, and you contrast it to the prevention standards, what works and what does not work, and you start having a traffic light system of things that are in line with the standards, things that are can be improved to be closer to the standard, and things that are far away from the standards that require a different sort of an approach. Either you need to de-invest in, or probably invest more in terms of their research and development to move them forward. And what are the supportive services that you have locally? So that modality will be more structured. And then you can map it out at different ages, within different sort of level of response, in the context of no one left behind, universal selected indicated modality. And also you can have an assessment of the functioning of that system in general, in terms of its comprehensiveness, its delivery modality, the regulations that exist and don't exist, the research quality, the research item, the coordination between the different entities that exist, and sustainability that of the processes moving forward. So all of these are elements that help not only talk about the interventions that are needed, but change the body that delivers that mechanism moving forward. And that's a new issue that's moving forward. And it is in that context that really supports more that early prevention and moving away than just focusing on the age when onset is happening, which is the age of youth. And focusing on an early age of development. And that culture of development, we're also excited from the fact that our same commission that I talked about before, that parliament of member states that are putting the resolution moving forward, in 2022 produced that resolution, which is a resolution labeled 65, which is the year of the meeting, the 65th meeting of the commission. On that occasion, which is in 2022, resolution number 4 is promoting comprehensive and scientific evidence-based early prevention. Early, not in the sense of early in the stages of substance use, but early in the ages of development, starting from inception onward. So addressing adverse childhood experiences and beyond, which is a radical change in the way of thinking of our member states moving forward. Our resolution, by the way, our resolutions should be adopted unanimously. This resolution came in before its adoption, co-sponsored by more than 30 member states, which also reflects the fact that there is an affinity to work like this, which is a very important cornerstone to build on. And that system of prevention really capitalizes on thinking early in the response. The fifth issue that we're working on is the quality of prevention. It's not only counting numbers and talking about the system, but the quality of what is being provided. So we as UNODC are working probably at two extremes of the spectrum of capacity building that exists. As I said, on the policymaking level, to change the mentality of policymakers in terms of the science of prevention, how to consider, how to build a strategy, strategic response for prevention, what works and what does not work. And at the other end of the spectrum, supporting them with demonstrated evidence of packages that are evidence-based, transferable to their context, demonstrating that that works. But in between, you have a machinery that is providing these services, where there are more and more tools that help these structures that are between the high-level policymaker or the mid-level policymaker and the service delivery structure to have a better context of what to do, how to fund, what initiative I should fund, quality initiative I should not fund, how can I map it out, what should be available in the prevention of family skills, what should be available at the school level or not. So there are more and more, like you probably heard about European, for example, one of the tools is EU prevention curriculum, the UPC, that is supported by the USINL. And so you see this is universal prevention curriculum at the level of the service, the coordinators and the policymaker and the service providers. So it's not availing a family skills package that is evidence-based and training a person as a facilitator for family skills, but probably how can I work with the machinery that is providing these family skills, I mean, that's one of the examples, to understand how family function, what should be the characteristic, the larger context, not only the content of the evidence-based program, but the larger context of that. So what we're working on is really professionalizing the field of prevention service delivery. So not only to qualify the person as a trainer on that package, but also a person that can be qualified on providing prevention services within a social institution. These are some of the examples that we are also available in terms of other institutions. For example, the European Drug Prevention Quality Standards and Toolkits would help policymakers or certain qualified professionals within the system qualify and check the quality of what is being funded. Another important characteristic is, as I said, the training of the delivery mechanism of the prevention, professionalizing that area of work. So the people that are delivering prevention in general at the different level of from high level to low middle level to service provider implementation level. Training, continuous training, specific training, on-job training, and beyond. This is an example where that mentality that we're talking of as an issue has been demonstrated in terms of its quality. And this is our colleague Fernando Salazar from Peru, where probably some of you might be aware of an evidence-based life and social skills package called Unplugged. And they have demonstrated the implementation of Unplugged, an evidence-based program, in some schools as compared to other schools where the Unplugged program has been coupled by, in terms of teachers that provide these, that specific package, with a larger package that the schools were there implicated and the larger districts, were the larger administration that these schools are implemented and were trained on a package of UPC that talks about this to change the school climate as that tool is being moved forward. And you can see that the effect of that same evidence-based package was superior in the schools that were changed in terms of context of thinking of how to address the problem over and beyond the effect of the evidence-based program per se. And that's a clear indication in terms of what is the value of improving the overall structure that is delivering that evidence-based program moving forward. And that's a key in terms of advocacy message that we're moving forward. The sixth issue that I want to reflect on is the implication of youth themselves in the prevention response, which is something that us as UN agency, as Secretariat, have a key regardless of which area of work we're working with, including, not to exclude, the issue of drug use prevention. So for us, yes, as the UNODC strategy from 2021 to 2025, we have clearly indicated the increased coverage and quality of prevention evidence-based services are there, focus on vulnerable population, including these children and youth. However, cross-cutting across all of our strategy is the value and importance of supporting the meaningful participation and empowerment of children and youth as in over and beyond their protection. They should be participating in these responses. And that's why we have, as an example, the Youth Initiative as part of the articulation of our prevention programming response globally. It has been developed by our section as a request of our executive director to engage young people on how to reflect on the effect of substance use in their school and community. Think about themselves being part of that policy-making perspective. Nothing about us without us, sort of a thing. So it was not a recently launched initiative. We have been, last year, we have celebrated the decade of the Youth Initiative, where youth come together and they share their experiences and ideas creatively, are introduced on the evidence-based prevention programming and policy making in line with the standards, and start thinking in terms of the community level, how can they be implicated in terms of advocating for that work moving forward. So it empowers them to be part of that policy-making response at the community level or beyond, to how to promote the health-centered evidence-based prevention programming, to contribute to support other youth through that work and supporting the sustainable development goal in their countries. So it connects youth together, and it in the country and between countries, to promote evidence-based prevention strategies. That empowerment is key, because more and more we see that youth are key drivers of policy-making change in their countries and beyond. This generation and the next generation is different than the generation before in terms of how much influence that they can have moving forward. We are giving them tools to not only be engaged, but to be engaged with quality and have the appropriate tools to engage. So here we have youth participation in drug prevention work. We have some campaigns that they can distribute and promote. We have a magazine where they reflect on the work that they're doing forward to influence local, national, and international policymakers. But also we have linked it to other initiatives where they can engage at a different level. So we have the Youth Forum, where they come themselves and talk to that Commission on Narcotic Drugs, addressing them and providing them with a message of what do they perceive as youth are priority issues that the Commission should put resolutions on. It's an informal structure, but at least it's a voice of the youth speaking to that Commission when the resolutions are being put moving forward. And we also have a grant mechanism where we try to support these youth in terms of doing these activities in the countries where we're in. We have the Drug Abuse Prevention Center that is an interesting modality of funding that comes from the people of Japan. It's actually the funds that are generated by youth, from youth, and provided to the UN to disseminate in terms of grant to other youth globally. So it's from youth, by youth, from youth to other youth globally. We try to incentivize them in terms of doing some activities at the local level that is in line with the standards. So that is the grant mechanism that I was referring to as the APC mechanism, and in terms of moving forward. So we have a series of grants since 2012. We have been producing at a small scale in different countries, in more than 55 countries, to really reflect the engagement of youth in this evidence-based prevention mechanism. And the Youth Forum, this is an interesting, very interesting forum that we have, where we bring these youth that are part of the Youth Initiative to come here to Vienna at the margins of the meeting of the commission for 3 days workshop where they come together, they brainstorm together a priority issue, and they address the Commission on Narcotic Drugs with a specific message in terms of priority. These are pictures of these youth that is coming in from in our CND of 2023, where you see their presence there at the podium of the meeting of the commission, and they're addressing the larger audience of the Commission on Narcotic Drugs in the presence of the president of the commission. If you go to the website of UNODC, there's a video of the address of the youth of every year, but this year was particularly interesting. I mean, the level of passion of these youth that are speaking, and actually its reflection on these policymakers when they are meeting here in Vienna is beyond description in terms of how impactful it is. Realizing that that resolution is not an ink on paper sort of a thing, but it is kind of a roadmap that really has an influence on the life of so many people moving forward, and that's a key message to move forward. Something that we are supporting in terms of moving forward is to expand on the work that we're doing. We're trying to avail now, and that's a new tool that we're developing, a tool for youth to provide prevention as a peer-to-peer package for older adolescents moving forward. This is work in progress and in development that we're trying to work on. And this is, we're going to be implicating several experts in terms of supporting us with this, but this is a key component to kind of make them also larger agents of this prevention response as an issue that we're moving forward with. So these were the priority issues that I wanted to discuss with you. I see that with the organizers, with Dora and Patty, we decided to leave at least a few minutes at the end for question and answers. And I would respect that without going to further issues that we have, to hear back from you and really reflect on my sincere appreciation for joining you on this very interesting panel discussion. Thank you very much.
Thank you. Oh, Dr. Maloof, so much information, so rich. And we've got a couple questions, but also we've got a couple updates. A lot of you have asked, just very quickly, if you don't mind, I'm going to share that the resource supplements for any sessions you've missed until now have now been uploaded into the lobby area underneath those sessions. So you should be able to access them there, because we know a lot of you are joining us from the West Coast. Okay, very quickly. So we have a little bit of time, and the ADAPT team and I were just sitting here really kind of pondering over some of the initiatives that you just brought up. I'm going to ask you about the Youth Forum and Drug Abuse Prevention Center grant program that you mentioned. We had a question come in around how youth are recruited for that specific program.
Well, our general mechanisms of moving forward is a mechanism where we send an invite to our permanent missions here. So all the UN member states have permanent missions that are represented here. We send a letter to the permanent mission to go back to the local government through the Ministry of Foreign Affairs to nominate that person. But there is a specific, the criteria that we discuss is the fact that that youth coming in is a youth that does not represent necessarily the country and speaking on behalf of the country, but speak on behalf of the youth that is and youth expectations of an engagement in terms of work. So the youth that's coming in, even if it's nominated from country X, is not a youth that represent that country per se. It is a youth that comes from that country, but speaks on behalf of youth in general. When they meet here, that youth also is with the forum, meets with other youth, and they just brainstorm together issues that are there, and they have a uniform and one statement that provide on behalf of all youth to the Commission on Narcotic Drug. So that also is not a kind of a country-specific representation, But it's rather a kind of a common voice of youth from different countries around the world coming in and speaking on behalf of other youth. So the mechanism, I know within that structure, is difficult to kind of to intervene ourselves or like to be influence a specific profile of youth, but that diversity of more than 40 youth coming in from different perspectives of context and cultural perspective coming in with a common vision in terms of like, this is a common voice of all youth together, is a way to kind of fine-tune that recruitment mechanism moving forward. And we have it over 13 years, so there's more and more diversity of geographic regions and geographic. The only restriction that we have is the age of the person, and that person being also engaged actively in their country in terms of in drug prevention responses. That's for the youth forum. I hope I addressed it as best as I can. For the grant mechanism as well, the DAPC grant is a mechanism announced. If anybody is interested, my email has been announced and can send me any messages. But regularly speaking, there's an announcement of every year for a call for proposal. I guess it's gonna be in June of the year. I'm not 100% sure, I have to admit, because I'm not overseeing the implementation of that specific component. But that there's all the criteria on terms of application are available within the deadline in terms of submission of grant, and all the grants proposal are being revised and aligned with our standards moving forward. And there's a quota of specific grants that we can accommodate per year. And we try every year to have as much geographical diversity as possible. But its announcement, there is actually, if in the pool of things you mentioned in terms of resources, Laura, on our website that has been put as part of the resources, there's a dedicated page for the Youth Forum. There's a dedicated page for the Youth Initiative, as well as for the grant mechanism. And everything that I mentioned is mentioned in much more accurate information that I mentioned. I described it generally speaking, but the dates of when everything is done and how is actually in our website available.
Thank you. Thank you. Yes, that's a wonderful response. And, you know, as I'm listening to you talk, and you're getting a lot of kudos here in the Q&A and the chat box, but just real quick mention that I had an opportunity to work with you on that particular document. And my experience being out there with you at the UNODC function related to the law enforcement's role in prevention document was very interesting, in that a lot of what you said related to this global perspective, right, and the standards that you all are relying on made a lot of sense to me when talking with people from across the country engaged in prevention work that have so many different perspectives on substances, but also are seeing very different things. While there are some common denominators across the world, there were very different substances causing unique problems in various countries. One person has asked about Delta 8-9 and that particular substance, wondering if you have a lot of experience with that from other countries, if there are policies in place in countries related to this specific substance and acquiring it either from storefronts or on the market somehow. Any knowledge related to that particular substance?
I have to admit, Laura, that I'm a bit concerned of providing any information that I don't master. I happen to be a person that works with people that actually are not using any substance, and actually really working with policymakers, asking them to remember that prevention initiatives are to a large extent substance neutral. So it is not the substance that's important, it's the person. However, we have a very large team of people that are experts either on the forensic side or on the treatment side of the perspective and on the monitoring of substances in general, where I can refer to for any further information of the substances that would provide a much more accurate response than mine. But I want to open a bracket and recognize really the significant value of your presence with us, Laura, in terms of sharing your expertise in the development of this guiding document, where it's true. I mean, when it comes to development of these guiding documents to really help institutions, yes, we need to find a common ground of the common science that bring people together, and not so people are passionate about prevention. And sometimes that passion could be counterproductive if you're addressing something that that is not in line with how things are being done. So I'm not talking about you, but you are coming in from a science perspective. But in our guiding documents, we don't only implicate the scientific experts, but we also implicate the governmental institutions that are responsible for the response. And this is where there is a diversity of responses. So getting that scientific spirits within that, it requires several voices from all over the world to kind of reorient that response. And it was very refreshing to have you on board with us, Laura. That is a common thing that we're trying to always focus on is, yes, the will is there, but how can we move that will in the appropriate direction without causing any negativity with people that are already investing their time and effort to actually do something good, but unfortunately not necessarily always doing it the right way. And that's a key component where we're trying to make the voice of science better heard with the policymakers.
Absolutely. Beautifully said, Wadi. Thank you so much for that. And the honor was all mine, by the way. All right, so we have a question coming in from a huge fan of yours. Thank you for a wonderful presentation. In school-based prevention, it is clear that teachers' training in prevention is critical, not just for prevention, but as agents of creating context in which the results can generalize to all aspects of the children's lives. Do you have any UNODC training manuals or other devices to bring a science base to teachers' actions?
A very challenging question, especially if it comes from a fan. Yes, but it depends on how. So I would like to orient the fact that we do have, I mean, I talk about the prevention standards in general, but we have a special document on that is a UNODC WHO UNESCO guiding document on providing drug prevention in the educational sector per se. So that's the policymaking within the educational sector in general that addresses that issue in a larger perspective. But for teachers, that's not only for teachers, but teachers also, when we're implementing life and social skills, we do have part of the advocacy messages that we kind of incentivize teachers to be implicated in the response is to tell them that we're not only talking to policymakers, but to you as well, that what works in the field of prevention in terms of life and social skills are interactive models of capacity building and resilience building in the children in terms of building social and emotional competencies. And that's a different way of doing business for you as a teacher. You learn a new modality of implementation there where you're not only lecturing, because that doesn't work really in the field of drug prevention, but you're bringing students in a circle and addressing a specific issue and making the children support and the youth, depending on the ages where the program is addressing, discuss with each other these problem-solving strategies, and you sitting on the side being a moderator. So that's a new technique of doing also teaching, which incentivizes some of the teachers to be engaged in these programs. We are not an agency that supports education per se, but we try within the work that we do in terms of drug prevention, have a key role in terms of supporting the educational structure, because we know that that school ethos itself, children feeling safe at school, having a teacher that knows the technique of interactive teaching, as well as a structure that understands what is a safe school environment, in addition to that evidence-based program, is a key component to make the program package work.
Wonderful, thank you. And I've got one quick one that I think you can answer in our last 30 seconds.
Uh-huh.
When we've got a lot of excitement and interest around the review of prevention systems pilot. When will more information be available on that for us?
Very soon, actually, because we have put it in practice recently in Norway. They happen to be a member state that supported us and offered themselves as guinea pig, if I can say, to implement the prevention standard in their perspective. And it has been put to test, and the results of it were just discussed with the Ministry of Health and publicly in Norway a couple of weeks ago, and the report is there. So with that initial experience of mapping out services in a context of a social welfare country as complicated as Norway, was a good starting experience for us to move that tool from being just a theoretical one to a practical one. And we're trying now to consolidate this and get it ready before the meeting of the commission in 2024. So it will be out very soon, and it was put in practice in a very valuable modality. And hopefully we'll share it in more details in upcoming discussions with you.
Thank you. In conclusion here, you have connected so many dots for us. We always promote seeing the big picture, right? And this is the first summit where we've lifted a little higher and have taken a look at the global perspective and what some of those maybe common points are, common messages across the world that really resonate not just with us, but with everyone. And you've really drawn those out and brought those forward. We can't thank you enough for your just very generous giving of your time today. I know that we've asked a lot of you, you're 6 hours ahead, and we just really appreciate you joining us. And I have no doubt you will be receiving some emails. Also, just a teaser, guys, he did mention ways of engaging youth, and he has hinted towards having some expertise, and he's kind of demonstrated a little bit in today's presentation ways in which they are working through that particular topic. We do plan on reaching out to Wadi again in the future to possibly host a technical webinar on this particular topic. And so you may be seeing more of him if we can squeeze it into his very busy schedule in the future. So thank you for joining us today.
Thank you, Laura. I'm honored, and I appreciate your invite, and I also can reciprocate your generosity of your time that you have provided with us to share your expertise as well. That's the least I can do. Thank you very much for inviting me to this very interesting, and I saw the panels and I saw the topics being discussed. It's a very important summit, so I'm more than honored to join you.
Well, get some rest this evening, and you'll have a nice sleep after your presentation today. Know how much that we are going to continue to simmer on your messages. Thank you.
Thank you very much. With pleasure. Thank you, Laura.
All right, at this time, we are going to conclude this session. You should have an evaluation pop up for you as soon as you close your box. We will be joining you on the next session where we'll be having an informal and fun discussion with Beth Connolly here from the Office of National Drug Control Policy. See you over there.